Groove 93 WMPZ, you're with Magic, and you're listening to Caring for the Community, brought to you by Blue Cross Blue Shield. This morning, our guest is Dr. John Lipman, a nationally recognized fibroid expert who's made his life's goal to educate and treat women who suffer from uterine fibroids. He is most known for pioneering work in the non-surgical UFE procedure, uterine fibroid embolization, and if you guys haven't heard about this, you really need to listen up. He's one of the most experienced UFE experts in the country, and he's performed more UFE procedures than any other doctor in the Southeast. Dr. John Lipman, how are you this morning?
Great. Thanks for having me.
And you are so welcome. This is a topic that affects so many women. So I'm glad that you could join us this morning so we could talk about this. It has affected myself, people I know, and a lot of people are going to the extreme of having hysterectomies, and this could possibly prevent that. So, yes, we're going to talk about uterine fibroids this morning. What are they, first of all? What are uterine fibroids?
Are benign tumors of the pelvis. It's the most common pelvic tumor seen in women. So it's very common in all women of childbearing age, but it is particularly prevalent in African American women. It's believed 1 out of every 3 women, regardless of race, have these tumors, and up to 80% of African American women of childbearing age have fibroids. Now, they're not all symptomatic, but they're extremely prevalent, very common.
Yes.
And as you mentioned, oftentimes patients that are suffering with the symptoms that fibroids can cause will often be told only about surgery, and there is a particularly other procedure that's a non-surgical procedure that replaces the need for hysterectomy. So the take-home message for today is that women suffering with the symptoms from uterine fibroids don't need to have surgery. They can have uterine fibroid embolization. It replaces the need for any surgery and replaces the need for hysterectomy, and that's very important.
And let me ask you this too, because a lot of times women hear about something like this and they're thinking that it's some kind of, they think, like you say, that the surgery is their only option, and they hear about something like this and don't think that it's, I don't know, I guess a legitimate call,
A lot
yes.
of times when people hear about UFE, they think, oh, this is something new or experimental or investigational. It's nothing of the sort. It is standard medical practice. It's been around for a long time. It's well proven in the gynecologic literature how safe and effective it is. So we've been doing this procedure over 15 years.
Okay.
So it's very safe, very effective. It's done as an outpatient. Patients go home the same day of the procedure with a Band-Aid.
Wow.
There's no cutting on, no stitches, no general anesthesia. All the stuff is done from the inside. The fibroids are treated very effectively, and over a matter of days to weeks, the patient starts seeing the symptoms improve. The recovery is very short because there's no surgery, about a 4 to 5 day recovery on average, so patients are out of work for about a week. And most importantly, which is something that is, I believe, is truly undervalued, is that a woman gets to keep her uterus.
Right.
Even, a patient's been told, well, you don't need your uterus anymore if you're not interested in having children. Well, that's wrong. I mean, the uterus has a lot of important functions outside of childbearing, and so
it's more of a health issue and not so much as worrying about bearing children.
Yes, I mean, we know the uterus has a lot of important functions besides childbearing. It's important for a woman's psychological well-being. There are a number of women that feel less of a woman after a hysterectomy, like a man being castrated. There are lots of women that have sexual dysfunction after hysterectomy, whether it's loss of libido, loss of orgasm. We know the uterus is important for bone health. Women that have hysterectomies have a much higher incidence of osteoporosis. And now, from more recent research, we know the uterus is important for heart health. Women that have hysterectomies have a much higher incidence of heart disease, cardiovascular disease, heart attack, than women that don't have hysterectomies. And the earlier you have it, less than age 50, the more dramatic this risk for heart disease is. So it's really important that if you can keep your uterus, and fortunately you can, because fibroids are benign tumors. They're not cancer.
Right.
They don't turn into cancer. So you can keep your uterus. So if you've been told you need, hysterectomy is the only option for you, that's wrong. There are other options, and uterine fibroid embolization Some people call it uterine artery embolization. They're the same procedure. UFE or UAE is an option for you, and you need to see someone that's experienced in the procedure. It won't be a gynecologist. It'll be a different physician called an interventional radiologist like myself.
Okay. So, Dr. Lipman, why does it affect African American women so much more than everyone else?
Well, there are believed to be two reasons for this. One is that it's genetically predisposed more commonly in African American families. We know the chromosome that affects and causes fibroids. We're not to the gene level yet, so we don't know what that trigger is, what actually causes a fibroid. We do know it grows with estrogen stimulation, progesterone stimulation, so hormones make fibroids grow. That's why they often grow during pregnancy and why they tend not to be an issue in menopause. So the first thing is genetic. It's more genetically predisposed in African American women versus other racial groups. The second has to do with body fat. Estrogen is stored in fat, and so the more fat you have on you, the more likely you're going to have issues with fibroids. And so you can't pick your parents. There's nothing to do, an individual can do about the genetics, but it's just one more reason why it's really important to be as lean as possible. Patients that we see in the office for consultation, we talk to them about weight loss. A number of patients that we see are overweight, some are obese, and so we talk to them about strategies about exercise and eating well, trying to lose weight. That will improve the symptoms from fibroids.
Okay.
It's just one more reason to be, to eat well and exercise. It's good for your heart health. It's good to prevent type 2 diabetes and stroke. It's also good for your fibroid health.
Okay, and those are some of the things that we can do to prevent fibroids. Are there any other things to do to prevent it?
We talk to them about food strategies. I mean, there are some foods that are helpful, anti-estrogenic foods, if you will. Certain soy products are good. They have plant-derived, what are called phytoestrogens. They compete for the same binding sites that endogenous estrogen does, and that can be helpful. So kind of replacing meat in your diet is helpful. As much as you can try to avoid meat, avoid dairy and caffeine. Those are all helpful things.
Right. And I wanted to ask you something before we go on from that, because we know some people out there are going, I'm not going to stop eating meat, or I'm not going to stop eating dairy. If they can't stop doing it,
right.
What's a better solution to cut it down to how many times a week? We
try to tell them to try to, moderation. If they can substitute, eating more fish, eating more fruit and vegetables. Fruit and vegetables have what are called isoflavones in them. Those are, again, good things as far as, anti-estrogenic foods. So the more fruit and vegetables you can eat, they're actually also in chocolate and red wine, but that's also good in moderation.
Okay.
But if you can try to avoid red meat or beef and chicken,
or at least cut it down to maybe once a week, or
whatever they can do is going to help.
Okay.
I mean, we know that people aren't going to be completely strict vegans or completely give up these things. It's very difficult, particularly when you're so used to having it in your diet. But whatever steps you can do to cut it down will be helpful.
Absolutely. So, when we suffer with the fibroids, it causes a big problem with so many things with a woman. Yeah. And sometimes the spouses don't understand what women are going through when they're dealing with this, when spouses or girlfriends, these people are really suffering.
There are over 1 million women right now in this country that are suffering with fibroids. A lot of them have been told that hysterectomy is their only option, which is not true, as we're talking about. But they're being told that, and so they don't want hysterectomy. They don't want any surgery. So they just basically sit on the sidelines and suffer with this. And we should talk about the symptoms of fibroids, because that's really important. The three common symptoms that you'll see with fibroids are very heavy menstrual bleeding, pelvic pain, and increased urinary frequency. Now, fibroids are very hard and firm tumors. They're like rocks. And if they're in the front of the uterus, women can feel them. They feel very hard and firm, and that's how they cause their symptoms. The ones that are located near the center of the uterus is hollow. It has a lining. The ones that are near the center of the uterus stretch the lining, causing this heavy flow. Those that are near pelvic nerves can press on them to cause pain. Those that are near the bladder act like a paperweight on the bladder, not allowing the bladder to fill, so the woman has to go more frequently. She'll often wake up in the middle of the night. And so these are the most common symptoms. In fact, the most common reason why women have heavy menstrual flow is due to fibroids. And so if you're suffering with this and you've only heard about surgery and you're not interested in that, basically these women are padding themselves up as much as possible and just kind of suffering. They're just, having this heavy, horrible bleeding. They're weak and tired, and they're just wore out. And it's a miserable. They're not living. It's really suffering,
Right.
as you said.
And the spouses don't understand. What can they do to help with wives or girlfriends when they're going through this?
One of the biggest helps is for when the actual spouse or boyfriend actually comes into the consultation when we talk to them. Because, as I say, you're right. A lot of times because women are bleeding so heavily, where the spouses come into play is oftentimes with, relations and sex. And,
yes.
When women are bleeding so heavily, it really interferes with their relation with their husband or boyfriend or what have you.
Because sometimes it goes on like for weeks at a time.
Absolutely.
Is that right?
Yes, so you're bleeding very heavily. And so when you're bleeding heavily, obviously you don't feel sexual.
Of course.
And the bleeding is such that you can't possibly replace this amount of blood that you're losing each month. So you become tired and weak. And so now, sex is exercise. So now you're tired, you're weak, you're not feeling sexual.
Right.
You're not feeling up to sex. And sometimes this can really cause a significant problem in the relationship. And that's why when we talk to the couple, we say, this is going to change. Right after the embolization procedure, the patient will see the difference. She will bleed a lot lighter. She'll have more energy. In fact, people think it's miraculous. They can't believe where they've sunk to. When you bleed like this month after month after month, you progressively get weaker and weaker and more anemic. You don't really see how far you have sunk into a hole until you go back to normal and see, in retrospect, you couldn't believe what you were doing, how far you had sunk.
Right.
Because the procedure is transformational. I mean, we started a women's fellowship called the Wear White Pants movement. When women, when they're bleeding so much, they can't wear white. It doesn't matter what time of year it is. So we started a movement because once these patients had the UFE procedure, they could wear white whenever they want. And so the white pants was like a metaphor for this freedom, this I have my life back again. It's transformational, and we've had these events. We have them a couple times a year, and it's an incredible event. We've had them at Phillips Arena. We've had it at Frank Ski's restaurant just opened.
Oh yeah.
We've had it at a number of places around Atlanta, and it's a lot of fun. It really educates the community. You have these other options. When they say you only have surgery for fibroids, it's not true. This procedure is tremendous. It's one of the biggest breakthroughs for women. The problem is oftentimes women never hear about it.
Right. And so you got a lot of women who choose to suffer in silence. Is it because it's one of those situations where they think people don't understand or they don't know what to do? Why do you think people...
Yes. I think it's a combination. Some of it is that all they know about is surgery. That's the only option they've been given, and they're not interested in that.
Right.
Also is they know, the fibroids won't kill them. They'll make their lives absolutely miserable.
Yes.
But it won't kill them to do... they just basically pad themselves up as much as possible, and they just kind of live with it, and it is, as we said, truly suffering. And, we have the answer. We just have to get people the information to know that they can keep their uterus, they don't have to have surgery, and they can have this relatively simple procedure and get their life back.
Okay. Well, Dr. Lipman, we're going to take a break and we're going to come back and we're going to continue talking about this. I know we have a lot of women's attention right now because anybody that you ask, if I ask 3 of my friends, maybe 2 of them could be suffering with this. I've heard it so many different times, and it does affect African American women so much. So I'm loving that we're able to give them this information, that they have an alternative to surgery, because if you can avoid that, this may be an option that you would want to consider. So we'll take a break. We'll be right back, and Dr. Lipman will continue giving us information on the UFE procedure, uterine fibroid embolization. So if people are skeptical, then this is something you really need to learn all of the information on. So we'll be right back. You're listening to Caring for the Community, brought to you by Blue Cross Blue Shield on WMPZ Groove 93. WMPZ Groove 93, you're with Magic, and you're listening to Caring for the Community, brought to you by Blue Cross Blue Shield. And we continue with our guest this morning, Dr. John Lipman. He is a recognized fibroid expert, and he is here to educate us about UFE. If you haven't heard about this, it's uterine fibroid embolization. A lot of African American women suffer with this, and we are trying to give you an alternative to surgery. So, Dr. Lipman, we have so many women that are only hearing about surgery or hysterectomies to treat their fibroids. So UFE, we're trying to give them this information to let them know that here's an alternative. You don't have to have surgery. And can you just enlighten us a little bit about people that are having these surgeries and don't know about UFE? What are some of the things that we can tell them?
Hysterectomy is an extremely common procedure. In fact, it's the second most common surgery performed in the United States, which is rather shocking.
Yeah.
Because half the population, i.e. men, aren't even eligible. So we're doing a lot of hysterectomies, and a lot of them, most of them, are unnecessary because the most common reason why we're doing a hysterectomy is not cancer. If a woman has uterine cancer, it's appropriate. But the most common reason women get a hysterectomy is for uterine fibroids, which are benign tumors. And so we want to stop the practice of doing just hysterectomies in people with benign tumors. And fortunately, we have an outstanding alternative, which is the UFE procedure you mentioned, uterine fibroid embolization, completely non-surgical, outpatient, treats all the fibroids in the uterus very effectively. A woman can get the relief of symptoms she's looking for, and most importantly, keep her uterus.
Okay. And, we talked about it a little bit, but in case somebody, made a call and say, hey, turn on the radio, they're talking about how to treat fibroids instead of surgery. What is UFE? How does it work? Let's explain that again.
The procedure works by, we gain access into the blood supply of the uterus. And you can think of the uterine blood supply as branches of a tree. There's a main uterine artery on each side, and they branch and get smaller and smaller till they get out to the leaves. The fibroids are the leaves. We know what size these small branches are, and we get into each uterine artery with a very tiny microcatheter and inject particles that will cut the blood supply off to all the fibroids, basically knocking out all the leaves of the tree. The big trunk and the main branches stay open, so the uterus stays alive. In fact, we've had children born after uterine fibroid embolization. So the fibroids are all knocked out, but the uterus stays alive.
Okay. So are there any risk or side effects? Because that's probably one of the biggest questions that women are going to ask.
Just like in any procedure, there are risks, but the risks for embolization is much, much safer than any surgical procedure. The risks of the embolization, essentially, there are two. One is there are some women that don't menstruate again permanently. That's why we ask women about their desire for fertility. Now, I've performed over 5,000 UFE procedures. As you mentioned, one of the largest experiences in the entire country. I've never seen a woman under the age of 40 not menstruate again. So the people that don't menstruate again typically are over 50. There have been some women between 40 and 50, and no one in my experience under the age of 40. So usually these women are not interested in fertility at that point, but we mention that as a risk to all patients. The second risk is that there are some women that will pass some fibroid material vaginally, maybe for a cycle or two or three cycles, and it stops. It's important that they know that. It's very unusual, but we see it in about close to 5% of women will pass some of that material, and it's fine. It's just important to reassure them that that's going to stop. It's not anything worrisome.
Okay.
And we've seen in 9 patients in 5,000 where we need the help of the gynecologist to remove a piece of fibroid that didn't come out on its own.
Okay.
But for the large majority of women, 95+% of women, the fibroids will start to soften and shrink over time and stay in the uterus. They just kind of, they go from like grapes to raisins over time. And as they do, the symptoms disappear. And they kind of die off just like they would in menopause, only we're doing this before then.
Okay. So most women, if they've gone to their doctors and their doctors are suggesting surgeries or hysterectomies to them, a lot of these women have been going to the same doctors for years and years and years, and they don't know about UFE. Why is it not as widely known, or why are the doctors not suggesting this treatment to their patients?
Well, this procedure is widely known. I mean, I say we've been doing it over 15 years. It's well proven in the gynecologic literature how safe and effective it is. So the gynecologists know about this procedure. They don't perform the procedure, and I think that's where this kind of reluctance comes in. They are used to handling all of the female issues, and while we see a lot of patients from gynecology referral, there are a number of gynecologists that will fail to mention this to patients, and that's why it's so important for women to know about this option. And if they're interested in pursuing this option, they need to see a different type of physician, an interventional radiologist like myself.
Okay, so they can ask their gynecologist, and some of them may know about it or may suggest it, and if not, then we just want to make sure that they have the information so that they know that this is an option and that they may not have to have surgery.
Absolutely. I mean, information is power. The more information, and this applies to anything, particularly anything in health. If you have a particular condition, you want to educate yourself as much as possible about that condition and really bring that information and discuss it with your doctors. And you should have lots of options.
Absolutely.
And your doctor may be able to help you with some of them, and he or she may have to refer you out to another specialist for other options.
Okay, and glad that they're hearing about the UFE procedure, because a lot of women just don't want to have a hysterectomy. They don't even want to hear the H word. And once they hear that, then, most women take time to think about, what am I going to do? And I guess that's why we're talking about some of them suffer in silence. And I guess one of the biggest reasons is, if you don't know, then you're worried about what's going to happen if I have a hysterectomy. What are some of the things that are going to happen and problems that could occur or that you could encounter once you have a hysterectomy? So could you tell people about that?
Yes,
Because I think that's one of the biggest fear of women, having a hysterectomy. What's going to happen after that?
Well, there are a number of negative consequences after hysterectomy. I mean, while it does end the fibroid issue, if a woman is suffering with fibroids and has a hysterectomy, it will end the fibroid problem, and that's great. The problem with hysterectomy is that it may open doors that women don't want opened.
Okay.
It can affect her negatively psychologically. There are a number of women that struggle with issues feeling less of a woman, again, like a man being castrated. So,
Right.
and there's no way to predict who that's going to be. It doesn't mean you're a weak person or something like that. It just happens in certain women. There are a number of women that have sexual dysfunction after hysterectomy. That's a big problem that people don't like to talk about because it's embarrassing.
Right.
But it's a fairly prevalent issue.
Yes, and that's one of the horror stories that I heard, that, that you have sexual dysfunction and that, you would have to be on some kind of medication for the rest of your life to, I don't know, regulate your hormones. I don't know. These are some things that I've heard. I don't know. So if you could clear that up.
There are patients that even if you leave the ovaries in, about a third of women will go into menopause after hysterectomy, even if they keep the ovaries. And a number of these women are placed on hormone replacement and other things. So, yes, they don't want to be on that. They don't want to be in immediate menopause. And so these are all important issues. And the surgery is unnecessary. You don't have to lose your uterus. If you're suffering with fibroids, you can have this non-surgical UFE procedure, get the relief you're looking for completely without any surgery, and you get to keep your parts. And it's a very important breakthrough, but many women have never heard about it, even though we've been doing this a long, long time.
Okay. And then, Dr. Lipman, unfortunately, we have some women that don't go to the doctor as regularly as they should. And we have some women that probably are having this problem and don't know exactly what it is. So what would be the symptoms of fibroids? How would they know that this is an issue that I really need to go to the doctor and have this taken care of?
Typically, it's from heavy menstrual bleeding. It's the most common cause of heavy bleeding in women. Oftentimes, what presents, a woman will go to her physician saying that her periods have become very heavy. Sometimes they report episodes of blood gushing out of them, flooding out of them like a faucet. It can be very concerning. Obviously, it can be frightening to a woman to bleed that heavily. She may pass large clots, and it's losing a lot of blood each month, and they can become quite anemic.
Right.
And so
But
that's
some
the
of the
most common
women
thing.
who are old fashioned, like I was saying about, not going to the doctor as much, they think that not that it's quote unquote normal, but they think that, okay, some women just bleed heavily like that. And they
Exactly.
don't look at it that no, this could be a problem.
Yeah.
They just think that I have heavy menstrual cycles
Yep.
and this is what it is and I understand that and I'm going to live with it. They don't know that there could possibly be a bigger issue and a bigger problem.
Absolutely. That's a great point, because we do see patients that come into the office and say, I'm a heavy bleeder. My mom was a heavy bleeder.
Exactly.
No, you're hemorrhaging. Your mom had fibroid issues and bled heavily, and now you're having those same issues. If you're changing pads more frequently than every 3 hours, that's too heavy.
Wow.
If you have to use more than, one pad at a time, if some people are doubling them up or using pads and tampons, changing them, sometimes every hour, every 30 minutes, if they get these episodes of blood rushing out of them, gushing out, or passing these large clots, that's all abnormal. They might be doing it for a long period of time and not realize that this is abnormal, but it is abnormal, and they need to talk to somebody about this, because, there are consequences for the anemia long term, and it's not normal.
Right. And see, I've heard this, for years. From when I was a young girl, I remember hearing like family members, and I remember them saying things like that. And I didn't think it was normal then because, but I didn't know any better. But there are so many people that really think that way, that's just the way it is, and it's always been that way. So this is definitely something that they need to look into and understand. It could be a problem. I'm glad you brought up the thing about anemia and, so many other issues that they don't know could stem from not paying attention to that particular problem.
Yeah, they will report being very tired or weak. The anemia symptoms are being tired, weak during their menstrual. They may get lightheaded or dizzy. They might chew or crave ice. That's a common thing. They may get migraine-like headaches during their menstrual.
Wow.
All of these things. They may notice hair changes, brittle hair, thinning hair falling out, more hair in the brush than they expect. All of these things are due to anemia, and they're easily corrected.
Absolutely. And uterine fibroid embolization. This is something that you really need to look into if you are having issues with fibroids, if you have been to the doctor and they told you that you have fibroids, because, this could be an alternative to having surgery. So is there a particular size that a fibroid has to be in order to not, because some women have golf ball size, some women have grapefruit size.
Exactly.
So could it be at any size that you can still do this procedure?
As small as a pea and be as large as a melon. It really depends on where they're located in the uterus. Those that are located centrally will stretch the lining, causing heavy bleeding. Those near the front of the uterus will press on the bladder, causing increased urinary frequency. She might wake up a number of times a night to urinate. Those are on the side of the uterus will press on pelvic nerves to cause pain. Those in the back of the uterus might even press on the colon to cause issues with constipation. We've seen patients that their doctors weren't aware that this chronic constipation had nothing to do with the bowels. They had undergone this major gastrointestinal workup.
Wow.
But the problem was this big rock, this fibroid pressing on the colon. And so
that made them not be able to pass.
Exactly. So fibroids can cause a whole host of different symptoms, but if they don't cause any symptoms whatsoever, and many women have fibroids, but they don't cause any symptoms, they don't need any treatment whatsoever. We call them passenger fibroids. They ride along in the uterus.
Okay.
They could ride along their whole life and never need anything done about them. It's totally fine.
Okay.
But when they cause these significant symptoms, that's when they need to go to their doctor and get this investigated further.
Okay, so here's another question for you also. Let's say, for the women who have already had surgery on their fibroids and they're just hearing about UFE, do fibroids come back? And if they've come back, can they get this treatment after a surgery? And
there are two types of surgery for fibroids. There is what's called a myomectomy, where you go in and you cut out surgically a number of the fibroids and then sew the uterus back together. Oftentimes, they can't take out all the fibroids. In fact, oftentimes they can't even take out the majority of the fibroids that are in there by number.
Wow.
They try to get the bigger ones because those are the ones that are the most likely to cause the symptoms, the bigger they are. And so they'll go for the bigger ones, but oftentimes they'll leave just as many smaller ones behind. And so those smaller ones will grow, and over a matter of several years, patients, and sometimes sooner, all the symptoms will come back just as if they had nothing. And so we've seen patients that have had several myomectomies, which is unfortunate.
Wow.
And so any of those patients that have had previous myomectomy and now their symptoms are back could have a uterine fibroid embolization and likely not need anything else ever again, because remember, the UFE procedure knocks out every single fibroid in the uterus.
Right.
Whether you have 1 or 100. The myomectomy can only take out a small percentage typically, because you have to have an intact uterus when they're finished, taking these fibroids out. You've got to sew the uterus back together, and there is a risk, and every woman that undergoes myomectomy has to understand this risk, is that she could wake up and have a hysterectomy. They go in for a myomectomy, but they can't get the uterus back together. They get into too much bleeding, and they wake up without their uterus. So there is a risk going in for myomectomy and waking up with a hysterectomy.
Wow.
If you've had a hysterectomy for fibroids, your fibroid issues are over with.
Right. Right, and it's that's exactly what we're trying to avoid.
Yes.
Is having to go to the extreme of just having the hysterectomy. So we're going to take another break. We're going to come back and we're going to talk about your white pants movement, and we're going to talk about how that came about for you and what it's all about, and see how we can get involved here as well. Okay.
Great.
All right, we're talking to Dr. John Lipman. He is a fibroid expert, and we are talking about the non-surgical UFE procedure, uterine fibroid embolization, trying to avoid having surgery or hysterectomy if you have uterine fibroids. You're listening to Caring for the Community, brought to you by Blue Cross Blue Shield on WMPZ Groove 93. WMPZ Groove 93, you're with Magic. You're listening to Caring for the Community. We're back again with Dr. John Lipman, nationally recognized fibroid expert, and we're talking about the non-surgical UFE procedure, uterine fibroid embolization. If you suffer from uterine fibroids, this is information that you really need to hear today. And we're back with Dr. Lipman. And Dr. Lipman, you founded the white pants movement. Can you explain to us what that's all about? We talked about it a little bit. Let's talk about how that came about and what it's all about.
Well, patients that are suffering with uterine fibroids, typically because of the heavy bleeding that they experience each month, they can never wear white pants, ever. I mean, they always wear dark clothes.
Yeah, that always scares a woman.
And so we started a movement because women that we saw that were suffering with fibroids, once they had the UFE procedure, their life was transformed. It was just completely different. The women prior to the embolization, not only could they not wear white pants ever, but their whole life was tied to their menstrual. It was truly suffering. They had to.
Oh yes.
Everywhere they went. Some people didn't even work 2 or 3 days a month.
Oh, absolutely.
They just couldn't leave the house. But if they did, they had to know exactly where the bathrooms were. They had to know where their sanitary products were. They had them all over the house, all over the office, all over every compartment, in their cars or they're at work. I mean, their whole life revolved around their menstrual. And once they had the UFE procedure, they get their life back. They get normal, light menstruals. They're not worried. They can now wear white whenever they want. And so we wanted to celebrate this. The white pants was like a metaphor, but we wanted to educate women that because there's over 1 million women in this country right now that are suffering with fibroids on the sidelines, just suffering and patting themselves up and not getting the relief because they don't want hysterectomy and they think that's the only option here. We want to educate women that they have this outstanding non-surgical option. They can get the relief they're looking for, all without surgery. We started this Wear White Pants movement, and it's becoming, very big now that we have these couple events a year where we invite women to come out. show off their white pants. Those women that have had UFEs, they love their ambassadors now for the procedure, and they bring friends, and we talk about fibroids and about getting your life back and what that means to them. And it's just a really fun event that has really blossomed exponentially in the last couple of years that we've started this movement. And anyone that's interested in the white pants movement can go to wearwhitepants.com and read more about it, or gotfibroids.com. We've got lots of information on the places we've been and information about fibroids and about the Wear White Pants movement. But it's really to educate women that they don't have to have surgery if they're suffering with fibroids.
And on that website, I think you have one of your actual patients that has gone through the procedure, and she has a testimony about it, because it's someone sitting at home going, I just don't think anyone could help me. But it's this woman, she was suffering through all of these same things.
Yep.
And
it's really powerful. I mean, to see people talk about their experiences. We had a woman that was at a jazz concert with her fiance, and all of a sudden she got this rush of blood come out and, just bled all over her skirt. She was totally mortified.
Oh my God.
With her fiance, and they're out in public, and it was just miserable. And she immediately went to her doctor, and her doctor said, well, you need a hysterectomy. And she just didn't want a hysterectomy and asked if there were any other options. He said no. And so initially she signed up to have a hysterectomy because she was going to get married later that year. And wanted to hurry up and be right for her wedding because she knew she was going to be out of work for 2 months if she had hysterectomy.
Absolutely.
But fortunately, she found out about us through the White Pants movement, and she had the UFE, did phenomenal. Her periods are now light and normal, and she's just can't believe how much better she feels, and she's thrilled because she really didn't want surgery, and she truly believes she has her life back, and she's one of the bigger spokespersons for the White Pants movement, and was really one of the many women that kind of inspired us to start this. And we've had great results with this. It rarely doesn't work for fibroids. Well over 90% of patients get dramatic relief in their symptoms, or their symptoms are gone. Another important spokesperson was Teresa Edwards, the star basketball athlete, Olympic medalist. She actually led the United States delegation this year into London, the Olympics. She was a patient of ours and is a very outspoken person for the White Pants movement. Her testimonies are, she's done a number of testimonies for the procedure, and, she's very outspoken about this and how great the procedure is. And so if patients go on our website, which is atlii.com, they will see lots of video testimonies, audio clips, a lot of information, not only about UFE, but about fibroids themselves.
Okay. And is it true that Condoleezza Rice had this procedure done?
Yes, she did. She had this procedure back in 2004. She had it on a Friday, and she went back to work at that time as National Security Advisor that Monday. So she was only out of work 3 days. I mean, Friday to Monday, which is a little bit, we don't recommend going back that quickly, but it just illustrates how quickly some people can recover from this.
Absolutely. And anyone can join this movement, right?
Oh, absolutely. It's totally voluntary. We encourage people to come out, and it's more fun, but it's also providing information to people to share, because they say a lot of times women never hear this information at all. And so it's important, not only all women, but particularly African American women, to discuss this, because this is a particularly prevalent issue in the African American community.
Correct. And then, it's just kind of a sisterhood or a camaraderie of other women that are understanding what you're going through.
Yes, and because a lot of times these silent sufferers, these people that are suffering with this alone, think, as you said, they're the only people going through this, and that couldn't be farther from the truth. This is such a common issue and such a common problem that we just want to educate people that you don't have to suffer like this anymore.
Absolutely. So what we're going to do is we're going to give the information on your website, the White Pants Movement. We can give your phone number for people who want to call you. Maybe they haven't been able to get the information here in Chattanooga, but if Atlanta's right down the road, and if they want to, if they want to call and get the information, or, if it's some way for them to find out if if the procedure's done here in Chattanooga. But what I do want to say is if they find someone to do this procedure, because you're a fibroid expert, so we want to make sure that if you find someone to do this procedure, that you make sure that you research and find out how long they've done it, and if they are, you want to make sure that you have someone that's experienced in doing this.
Absolutely, yeah. Just like in anything else, you want someone that is very experienced and who does this very commonly. This is what we do, and anyone that's interested in hearing about our practice, the website is atlii.com. It stands for Atlanta Interventional Institute. So atlii.com is our website, or they can find us through the other websites we mentioned, wearwhitepants.com or gotfibroids.com. They will find us that way as well. Our office phone number is 770-953-2600.
Okay, let's give that number again.
Yeah, 770-953-2600.
Okay, and then that way they can just pick up the phone if they want to call
Absolutely.
and ask questions, or if they just want to go to the website and read about it. But just at least take the time to see if this is an option for you. Find out everything that you want to know. Write down all of your questions, and I'm sure that you guys would be more than happy to answer all of those.
Absolutely.
Yeah, that's what it's all about. It's the UFE procedure, uterine fibroid embolization, is a procedure and hopefully to prevent surgery or hysterectomy. Is there anyone that isn't right for this procedure?
Almost any woman that has been told she needs a hysterectomy for fibroids would be a candidate for the UFE procedure. We get imaging and talk to patients and go over their symptoms, go over the imaging. The imaging is what's called an MRI of the pelvis. It's more detailed. They may have had an ultrasound, but this is much more detailed information than an ultrasound. And we go over the patient's symptoms, and we correlate that with where the fibroids are. You can see exactly how many and how big each of the fibroids are throughout the uterus. In fact, the ultrasound usually significantly underestimates the number of fibroids that are actually in the uterus. So the MRI is like high-definition television.
Okay.
You can really see everything to great detail. And so the woman will get an MRI, and then we will go over the MRI in consultation with her. And so we want to make sure, but pretty much almost every single patient that has been told that they need a hysterectomy for fibroids is a candidate for the UFE.
Absolutely. So once again, let's give your website address, your White Pants address, and then the phone number if they like to give you a call.
Yeah, our website address is atlii.com, and they can also look up the White Pants movement at Wear White Pants, spelled it out, WEARWHITEPANTS.com, and our office phone number is 770-953-2600.
Well, thank you so much, Dr. Lipman, for joining us this morning. I know you're going to get some phone calls, and I'm going to make sure I keep the number because I'm probably going to get some phone calls also.
That's fine. I'd be happy to answer any questions anyone would have. They can leave their email addresses. I can email them back, or their phone numbers. Be happy to talk to them. It's just important information that they may not get anywhere else, and so that's why I really appreciate the opportunity to come on your show and talk about this.
Absolutely, and you're so welcome. And thank you once again for joining us this morning.